Hi, my name is Kevin Camacho. I'm going to be talking about intestinal obstructions. Um, in this slide, you see the symptoms of intestinal obstructions, and this could be anything from distended abdomen, severe abdominal pain, nausea, vomiting, diarrhea. You want to assess this by obviously doing an abdominal assessment, palpating, and visualizing, checking for any distension and whatnot. Um, and then the key finding here would be the nausea, vomiting, and diarrhea. If you have a patient that's exhibiting one or more of these signs, you're going to want to address the electrolyte imbalance because of the amount of fluid loss that they have with the vomiting and the diarrhea. On this slide, I'm going to talk about causes of intestinal obstructions. Intestinal obstructions have a long list of possible causes. The two major categories that break down all of these causes are mechanical and pseudo obstructions. Mechanical obstructions have a mechanical cause, obviously given away by the name there. These are things that are like impacted stool, adhesions, hernias, even like twisting of the intestines. Any of that stuff can cause a mechanical stoppage from stool to pass on from that point of the intestine. The pseudo obstructions, these are caused by other things like bacteria, medications, or even like blood flow complications to a segment of the intestines. So essentially, once the stool gets to this point of the intestines, this tissue can already be dead even. And at that point, once the stool arrives there, none of the muscle tissue or the smooth muscle is able to continue moving on the stool. So that essentially causes a blockage because the stool isn't able to pass that specific point. And that's caused by, or that's categorized as a pseudo obstruction. In addition to the abdominal assessment, you're going to want to get some diagnostic imagery to definitively diagnose an obstruction. Anything as far as the imagery goes, X-rays, CT scans, ultrasounds, these can all be utilized to quickly identify an obstruction. And depending on the severity, that's where the provider will decide which kind of intervention is appropriate. So this slide's a little bit vague. The reason for it is because there's so many categories of, not categories, I'm sorry. There's so many causes for intestinal obstructions that each cause can have a different intervention, different recovery time, different treatments. So to generally touch on the topic, this is what I got together from all of the different intestinal blockages. So the treatment would start with avoiding solid food. So obviously the patient becomes NPO, and on top of that, not just the dietary changes, but pain and nausea medication can be administered to the patient. If the patient's consistently vomiting, then obviously some pharmacological intervention needs to be taken, because they're only furthering their electrolyte imbalance, possibly their acid-base imbalance that they have going on, and their dehydration. So, and on top of that, a nasogastric tube can be inserted into the patient to suction out air and kind of remove some of the pressure in the abdomen, because the blockage not only stops stool from passing, but also can stop any gas from passing. So having a way to kind of vent that out and lessen the pressure in the abdomen can be a big relief to the patient. And then depending on the severity of the obstruction, some of the intestinal tissue can die or the obstruction, like I said, with the pseudo obstructions, can be caused by some death in the intestine or necrotic tissue. So that's when surgical intervention is indicated. And then the follow-on care for the patient with an intestinal obstruction, it just depends on the intervention taken. So about